Good morning. I'd like to call this additional meeting of the Committee on Health to order. Today is Wednesday, June 5th, 2024. We are in room 123 of the John A. Wilson Building. The time is 11:05 a.m. I'm at-large Councilmember Christina Henderson, Chair of the Committee on Health. I want to note the presence of the quorum with Councilmember Zachary Parker from Ward 5 and Councilmember Brianna Doe from Ward 1. Today, we will consider 13 nominations to boards and commissions under the Department of Health. We will vote in block on the nominees to each board or commission just to expedite time. So I will first start with the Board of Medicine, which the mayor has nominated 4 individuals to the Board of Medicine. PR 25-758 nominates Dr. Miriam Michael as a licensed physician member of the board for a term to end August 3rd, 2027. Dr. Michael is a physician at Howard University Hospital and a medical director of the American Renal Associated Dialysis Center. Dr. Michael received her Doctor of Medicine from Howard University, and she is a Ward 1 resident. At the roundtable, I discussed with Dr. Michael her passion for patient-centered care and specifically increasing trust for physicians when it comes to vaccines and routine immunizations within primary care. PR 25-759 nominates Dr. William Strudwick for reappointment as a licensed physician member for the board for a term to end August 3rd, 2026. This would be Dr. Strudwick's third and final term on the board. He currently is the chair of the emergency medicine at Howard University Hospital and previously served as the medical director of the emergency care center at Providence Hospital from 2004 to 2023. Dr. Strudwick received his Doctor of Medicine from Howard University, and he is a Ward 4 resident. At the roundtable, Dr. Strudwick described how fulfilling serving on the board has been and his desire to increase the use of AI and technology to improve the board operation efficiencies. Dr. PR 25-760 nominates Dr. Amra Madkour as a licensed physician member of the board for a term to end August 3rd, 2026. Dr. Madkour is an obstetrician and gynecologist at the George Washington Medical Faculty Associates and is also serves as an assistant professor at GW School of Medicine and Health Sciences. He received his Doctor of Medicine from Texas Tech School of Medicine and is a Ward 5 resident. At the roundtable, I discussed with Dr. Madkour his additional qualifications in integrative medicine and his passion for bringing a more whole person care into the medical profession. PR 25-761 nominates Dr. Harry Barbie as the consumer member of the board for a term to end August 3rd, 2025. Dr. Barbie is an assistant professor in the Department of Health, Behavior, and Society at Johns Hopkins University. Dr. Barbie holds a PhD in sociology from Florida State University and focuses their research on gender, sexuality, aging, and health, particularly within the LGBTQ+ communities populations. They are a Ward 1 resident. At the roundtable, Dr. Barbie discussed their research on LGBTQ health disparities and aging and a desire to bring this expertise to developing policies within the Board of Medicine. At this time, I'd like to open the floor for any discussion on these 4 nominees to the Board of Medicine. Okay, hearing none. Oh, go ahead.
Chairperson Henderson.
Councilman Parker.
I would say I did go back and watch the hearing. I appreciated the wide range of diversity represented on these boards and the perspectives they bring. I thought the question and dialogue back and forth that you led was great. Just wanted to confirm all of these members are district residents.
Yes.
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 Awesome. And I look forward to supporting each of them as I think they will be a net positive for the district. Thank you.
Thank you. Councilmember Nadeau?
No, ma'am.
Okay. All right. So I will now move in block the committee prints and accompanying committee reports for PR 25-758, 759, 760, and 761 with leave for staff to make technical changes in consultation with the Office of General Counsel. All in favor, please say aye.
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 Great. Let the record reflect that was a unanimous vote. We'll now move on to our nominee for the Board of Podiatry. PR 25-786 nominates Dr. Teresa Hilliard as the licensed podiatrist member of the Board of Podiatry for a term to end April 16th, 2027. Dr. Hilliard was first confirmed to the board in 2006 and currently serves as the chair of the board. Dr. Hilliard is a practicing podiatrist with Family Podiatry LLC, a medical practice located in Landover, Maryland. She is also the founder and CEO of Family Podiatry LLC. Her practice serves senior communities and medical facilities such as George Washington University Hospital and Howard University Hospital. Dr. Hilliard received her Doctor of Podiatric Medicine from the New York College of Podiatric Medicine. She is a Ward 4 resident. At this time, I'd like to open the floor for any discussions on Dr. Hilliard's nomination. Okay. Hearing none, I will now move the committee print and accompanying committee report for PR 25-786 with leave for staff to make technical changes in consultation with the Office of the General Counsel. All in favor, please say aye.
Aye.
Great. Let the record reflect that was a unanimous vote. We'll now move on to the nominations for the Board of Dentistry. The mayor has nominated 3 individuals. PR 25-791 nominates Dr. Chanel Roberts as a voting member to the Board of Dentistry as a dentist licensed in the District of Columbia with a term to end November 30th, 2025. Dr. Roberts is a general dentist at Capital Dental and has previously worked at the Maryland Center for Aesthetic Dentistry. Dr. Roberts earned her Doctor of Dental Surgery from the University of Missouri, Kansas City. PR 25-792 nominates Dr. Amani Lewis as a voting member of the Board of Dentistry as a periodontist licensed in the District of Columbia with a term to end November 30th, 2025. Dr. Lewis owns and operates Lewis Periodontics Associates PLLC, a periodontal practice in the district. Dr. Lewis earned his Doctor of Dental Surgery at the University of Michigan. He is a Ward 4 resident. PR 25-793 nominates, hang on one second. Apologies. All right. PR 25-793 nominates Michelle Latortu as a voting member of the Board of Dentistry as a dentist licensed in the District of Columbia with a term to end November 30th, 2025. Dr. Latortu owns and operates District Dental Services, a DC-based nonprofit that provides dental services for underserved communities, and she is a Ward 8 resident. At the roundtable, I discussed with the nominees ways to improve the licensing process for dentists and access to dental care in the district. The nominees also expressed their discontent with licensure eligibility provisions in the proposed Dental Specialties and Licensure Scope of Practice Act of 2023, which the Committee on Health will hold a hearing on next month. At this time, I'd like to open the floor discussion on these 3 nominations. Okay. I will now move in block the committee prints and accompanying committee reports for PR 25-791, PR 25-792, and 793, with leave for staff to make technical changes in consultation with the Office of the General Counsel. All in favor, please say aye. Aye.
Aye.
Great. Let the record reflect that was a unanimous vote. Okay. And then our final nominations are for the Commission on Health Equity. The mayor has nominated 5 individuals to the Commission on Health Equity, and I will note that this particular commission has not met since 2021. But through discussions with DC Health and the nominees, the committee understands that the commission plans to reconvene, as well as produce updated reports on health equity findings and advise DC Health, the council, and the mayor on the best ways to advance and achieve health equity here in the district. The council selects 3 of the 9 members of the commission. And I have been in touch with DC Health about the process for us to appoint those new members. So I'll just mention for fellow committee members, if you have persons in mind, there are some areas of expertise that they need to meet in terms of a basic qualifications, but please let us know. PR 25-740 nominates Nicole Strachan as a voting member with expertise in early learning and education for the Commission on Health Equity for a term to end February 1st, 2026. Ms. Strachan currently serves as a speech pathologist at MedStar Georgetown University Hospital and Howard University Hospital. Ms. Strachan has worked as a speech language pathologist for over a decade, including within DC Public Schools. She holds a Master's of Science in Speech Pathology from New York Medical College, a Master of Science in Bioethics from Columbia University, and a Master of Divinity from Howard University. She is a Ward 3 resident. PR 25-741 nominates Mighty Fine, a voting member with expertise in minority communities and population health outcomes for a member of the commission with a term to end February 1st, 2026. Mr. Fine currently serves as the president and CEO of Mighty Fine Consulting, LLC, and is the director of the Center of Public Health Practice and Professional Development for the American Public Health Association. He holds a master's of public health from Yale University School of Public Health and Epidemiology and is a Ward 6 resident. PR 25-742 nominates Dr. Suana Linhales Barker as a voting member with expertise in minority communities and population health outcomes and improvements to the commission for a term to end February 1st, 2025, which I recognize is not that long. So we'll likely be seeing a renomination from her very soon. Dr. Lynn Hales Barker is currently the Chief of Programs and Community Services at La Clinica del Pueblo, a federally qualified health center in the Washington District, in Washington, D.C., where she oversees community-facing problems that address social and structural determinants of health. Dr. Lynn Hales Barker previously conducted research for the State University of Rio de Janeiro Center for Adolescent Health Studies. She earned her Doctor of Science in Public Health from the National School of Public Health in Brazil, and she is a Ward 4 resident. PR 25-743 nominates Ana Lopez Van Balen as a voting member with expertise in economic and community development for a term to end February 1st, 2025. Ms. Van Balen is currently the Vice President of Economic Security and Justice at Futures Without Violence. Previously, she served as the first affordable housing preservation officer at the Department of Housing and Community Development, helping to preserve the diminishing stock of affordable housing here in the district. She became the first director of housing policy and programs for the Office of the Deputy Mayor for Planning and Economic Development, where she oversaw housing-related initiatives across the government. Ms. Van Halen earned her Master of Science in Social Work from Columbia University and is a Ward 1 resident. Finally, PR 25-744 nominates Dr. Linda Elam for reappointment as a voting member with expertise in social and human services for vulnerable populations for a term to end February 1st, 2026. She currently serves as the Chief Executive Officer and Plan President for AmeriGroup, District of Columbia. Previously, Dr. Elam served as the Director of the Office of Disability, Aging, and Long-Term Care Policy at the U.S. Department of Health and Human Services. Dr. Elam earned her PhD in Health Policy and Management from Johns Hopkins Universities and is a Ward 5 resident. At this time, I'd like to open up the floor for these 5 nominations. Councilmember Parker.
Chairperson Henderson, I just want to note how great it is to see so many dynamic individuals want to and agree to serve on these various boards. They all play a very critical role to the comprehensive health systems of the district. And I must note, across all of the boards that we are voting on today, there were quite a few Ward 5 residents. I'm thrilled to have everyone stepping up, and I look forward to supporting all of their nominations.
Thank you. Councilmember Nadeau.
Nothing to add, Madam Chair.
Okay. I look forward to the work of the commission. As I mentioned, the commission has been sort of defunct since 2021, but the nominees all seem very eager to jump in. And so on the council side, we just need to do our part to get our 3 nominees, but we will make that happen. So I will now move and block the committee prints and accompanying committee reports for PR 25-740. 741, 742, 743, and 744, with leave for staff to make technical changes in the consultation with the Office of General Counsel. All in favor, please say aye.
Aye.
Great. Let the record reflect that those were unanimous votes. I once again want to thank this excellent group of nominees for their willingness to serve the district. And this is my PSA for those of you at home who are considering sharing your expertise by serving on one of the district's board or commissions. This concludes today's Health Committee meeting. Our next roundtable will be Thursday, June 13th, where we will hear from several nominees to be on the DC Food Policy Council. The time is 11:20 and this meeting is adjourned. Thank you all very much.
Thank you.